Welcome to the Taking the Pulse Conference 2013, hosted by the Metro North Brisbane Medicare Local. I'm Sophie Scott, I'm the medical reporter for ABC Television, and I'll be your host today, and I'm very pleased to be here.
This event is the culmination of some great work and initiatives of the staff of the Medicare Local. The board can't take much credit at all, but they've been ably led by our CEO down here, Abby Anderson, and also our Planning and Engagement Manager, Robin Grigg, whom you'll no doubt hear from during the day. As a bit of background, the formation of Medicare Locals is a relatively new event and was driven by the health reforms that were introduced by the Rudd and Gillard governments in the last few years. And Metro North Brisbane Medicare Local has been operating since 1 July 2011, so a very short period of 21 months.
And we're very interested in hearing your innovative ideas about how our community can have improved access to better coordinated healthcare, because as Sophie said earlier, that's in fact what this Medicare Local is all about, innovation, access, and coordination. So just what is it that we're bringing all together today? Well, really it's the culmination, as Mike mentioned, of a lengthy planning process that we've been undertaking, which is we've tried to describe on this slide. And then we've tried to pull all of that together to help us to determine the priorities for action, and in particular for action by the Medicare Local in our resource allocation for next year, but also hopefully to help inform and influence the plans of the Hospital and Health Service, as well as the plans of others like local service providers like yourselves and NGOs and others who are here.
I think most importantly, there has been a one-size-fits-all approach to healthcare delivery, and I'm particularly excited to hear about the work that's being done up here, which really clearly indicates you are trying to really break that down. There is little acknowledgement that services must be locally responsive and must take into account the different needs of different people, the different circumstances that people find themselves in, and the different geographic locations in which we live.
Taking the pulse was a new layer in the model for planning, and you've already heard that that's been very much about a community conversation, and it actually was a whole lot of fun. I have to say I was sceptical at first, thinking, what's this going to give us? It actually gave us some very rich information. A community conversation about health and well-being was something that was like a level playing field for people. It was something people were comfortable talking about. And when we look a little bit further on at some of what we learned, you'll see how it does enrich the data we've gathered.
I think that what we know is that we need to provide opportunities for communities to have input into what they need from their health. I think that most of the evidence really shows us that it's actually people's social environment that actually impacts on whether you have good health or poor health. So things like housing, education, social disadvantage, gender, homelessness, all of those issues are really important.
I think a lot of stigma with the community, and I've been involved with the community for a long time, and trying to put health issues across and get their voices heard, is that, oh, what can we do to change? You know, we're not going to make a difference. That's an attitude that really needs to change by the consumer. The doctors haven't got the answers. They don't know. They can't read their mind. You walk into a clinic, and I always say to people, "Did you ask the question? Why didn't you ask the question?" And they can't answer it. So unless they open that communication up with their health professional, whether it's a nurse or anybody, they're not going to get the communication started.
Yeah. From what I've been listening to, that a couple of presentations I've seen, people said the actual data says the issues aren't what would leap to mind. Yes, so perhaps data and information is quite valuable to focus the resources on particular problems. One example is in one area, everyone thought that drug and alcohol was a major problem, but looking at the data, it said that cancer was a far bigger issue and that the resources should be directed towards cancer. So finding out the actual picture, the grassroots picture, I guess, can really save a lot of wastage and be more effective.
I think the great thing about the work that's being done in this area, in this Medicare local, is an absolute genuine commitment to actually making sure that decisions and planning are based on the views of ordinary people.
What we see the role of Medicare local is to demonstrate what that something might be. We can demonstrate the value of the primary healthcare sector, all of the work that you do. It is our job, I guess, to showcase that, to promote that work, to try to develop some evidence around that, to develop some arguments, and to demonstrate the value of the saving to the system and the solution that the primary healthcare that primary healthcare services are to the crisis in health. We'd encourage your advocacy, and we certainly, it's great to hear people talking to their local MPs, both federal and state, about what needs to happen. But we can encourage that work. And I guess our job is to say, we have the solutions, we have the technology, we know how to keep people out of hospital, we know how to get people out of hospital more quickly. We simply need some investment to expand those services, and I suppose part of our role is to identify that and promote the great work that you're all doing. So we're very pleased that you're on this journey with us, and we hope that we can hold your faith and that we continue to promote and improve primary healthcare. Thanks very much.